cancer. Cancer is a term that is given to a collection of related disease processes that are characterized by uncontrolled abnormal cell growth, and these spread into surrounding tissues. Normal and malignant skeletal cells are shown in the images. A are normal skeletal muscle cells. B are malignant tumor cells. By adulthood, most of the body's normal cells only grow and reproduce through mitosis. This is a form of cell division that results in two cells having the same number and type of chromosomes. These cells replace damaged or dead cells following an illness or an injury. Cancer cells are called malignant because of the damage to the cell's deoxyribonucleic acid, or DNA, that causes these cells to reproduce in an uncontrolled manner, and then they invade other tissues and organs. Cancer cells multiply continuously in a disorganized way, often growing on top of each other, and then form a mass or a tumor. The cancerous cells continue to grow and expand locally, and then they can break off and travel through the bloodstream or the lymph tissue to other parts of the body. This is called metastasis. The body has a different ability to withstand the effects of cancer-causing substances or carcinogens to maintain a healthy immune response and to repair damaged DNA. Immunocompetence, or the capability of one's immune system to deal with foreign cells, which can be bacterial, viral, or malignant, this decreases with age, and this is the single biggest factor for developing cancer. Cigarette smoking has been linked to cancer of the lung and is thought to also be linked to esophageal, pancreatic, bladder, and kidney cancers. Immunosuppressant drugs are used to suppress organ transplant rejection. These can be a cause of non-Hodgkin's lymphoma. Synthetic estrogens have been linked to a higher incidence of endometrial cancer. It is believed that about 90% of all head and neck cancers are tobacco and alcohol related. The UV rays of the sun can produce skin cancer. The relationship of intense and prolonged exposure to these rays and the production of cancer cells was first discovered when it was noted that there was a high incidence of cancer, especially leukemia, among people who pioneered studies of X-rays or worked with radium and uranium. Radon gas is a colorless and odorless gas that is found with the decay of radioactive materials in rocks and soil. Viruses are capable of introducing new genetic material into a normal cell and then transforming it into a malignant cell. This damage reduces the body's ability to fight off cancer-causing viruses such as HPV. Some cancers, like Kaposi's sarcoma, are only seen in HIV-infected or severely immunocompromised patients. Many cancers are caused by mutated genes throughout one's life cycle. There have been genetic markers found for specific cancers. Predisposition means that certain types of cancer seem to strike at a certain age, a certain sex, or racial groups more frequently than others. Obesity has been strongly linked with the development of several cancers, and these will include the pancreas, breast, esophagus, kidney, and endometrium. Common cancer-promoting factors besides obesity are insulin resistance and inflammation in individuals with type 2 diabetes. When considering the TNM staging system, examples would be T1N0M0. This means that the tumor is small and localized, that there is no involvement of any regional lymph nodes or metastasis. Another example is T1N2M1. This indicates a small tumor with moderate regional involvement that has metastasized to one organ or site. Older adults have a higher risk for developing cancer. This is due to their immune system not being as efficient as that of a younger individual. This is why there are many cancer screening programs that are suggested to start at age 40 or 50. Biopsy is the removal of living cells to be examined under a microscope. Radiologic studies or X-ray films might be the first step in examining the body for cancer. This does promote the visualization of bone and hollow organ tumors. An endoscope or endoscopy, this is an instrument that is used for direct visualization of an internal body part. This is designed to be inserted and passed along the interior of hollow organs and cavities. Chemotherapy may be used as an adjuvant treatment after surgical removal of a tumor. The treatment methods are chosen after the prescribing physician has considered many factors, as well as keeping the best interest of the patient in their mind. Surgery is one step to help decrease the spread or to remove cancer from an individual. Radiation therapy utilizes high energy radiation from gamma rays or ionizing radiation beams. This is used to control or kill malignant cells, to prevent tumor recurrence, or to relieve symptoms of pain or discomfort. The radiation source must come into direct contact with the tumor tissue for a specified amount of time. Most implants will emit a low-level radiation while they are in constant contact with the tumor cells. Nurses caring for patients receiving internal radiation must take specific precautions. 4 principles of radiation protection: the further the distance, the greater the protection. The closer the distance, the less likely the protection for the individual. Chemotherapy can be given before a surgical procedure to assist in shrinking the tumor, known as neoadjuvant chemotherapy, or after surgery, known as adjuvant chemotherapy. Chemo can also be given with other treatments like immunotherapy. There are various chemotherapy medications that are available in oral form to be taken by mouth. Chemotherapy is only to be administered by a registered nurse who has completed an approved chemotherapy program and that has demonstrated competence in administering the agents. The practical nurse does not administer chemotherapy within their scope of practice, yet the practical nurse still bears responsibility for monitoring the patient during the chemotherapy administration, because this responsibility is relying on all nurses that provide the patient care. The toxicity that is associated with chemotherapy is most evident in the cells of the body that have a short lifespan. And these cells must continually reproduce to provide the body with the normal cells that it requires. The cells that have a short lifespan include blood cells, hair follicles, and epithelial cells of mucous membranes that line the digestive tract. Examples of hormone therapy include tamoxifen and aromatase. These are inhibitors, such as Femara, which has been shown to be chemopreventive for women with high risk factors and for recurrence of specific types of breast cancer. Biologic response modifiers. These are agents that manipulate the immune system with the hope of controlling or curing a malignancy with little or no toxic effect on the normal cells. Interleukins, these help the immune system cells recognize and destroy any abnormal cells. Interferons, these slow cell division in cancer cells or interfere. They stimulate natural killer cells or T cells. They delay the appearance of oncogenes or cancer-causing genes. And interferons also assist cancerous cells to revert to a more normal cell. Monoclonal antibodies are manufactured using genetic engineering to make antibodies against specific cancer cells. These monoclonal antibodies work by binding to antigens on the cell surface of the tumor and prevent the cancer cell from growing and dividing. Targeted therapies are a newer form of cancer treatment that actually block the growth and spread of cancer by interfering with specific cellular growth pathways or molecules that are involved in the growth and reproduction of cancer cells. Bone marrow transplant is routinely used to correct severe bone marrow damage that is caused by chemotherapy or radiation. Stem cells may be transplanted to overcome the devastating effects of chemotherapy or total body irradiation before biologic response modifiers are provided to the patient. There are various adverse effects or problems with the treatment of cancer. Anorexia and malnutrition are extremely common. Mucocystis is common. There significant weight loss, nausea, vomiting, and diarrhea with chemotherapy, constipation with opioid for pain, a decrease in the white blood cell count, a decrease in the hemoglobin count, which leads to anemia. The patient can also encounter bleeding problems. Fatigue and pain are something that also are common with cancer. Many cancer patients experience an alteration in taste that can be due to the progression of cancer or the treatment of cancer. Often they refer to it as a metallic taste. The patient with anorexia can experience the significant weight loss of 2 or more pounds per week and may suffer from severe malnutrition. Patients that undergo chemotherapy may experience mucositis or sores in the mouth. Stomatitis is an inflammatory reaction of the mouth. Both of these, mucositis and stomatitis, cause pain and interfere with eating and swallowing, which will lead to a decrease in weight or an advance in weight loss. Many cancer medications are emetogenic. This means that these induce vomiting. Nausea is common with cancer medication, even if vomiting is controlled. Chemotherapy-induced nausea and vomiting may persist for 1 to 2 days after chemotherapy is given to the patient. When the patient ends taking the medications, the nurse should teach them to start retaking the medications at the first sign of nausea to prevent it from becoming uncontrollable. The nurse should educate the patient on avoiding high-fiber foods because these foods encourage rapid evacuation from the bowel, and to add low-fiber food like bananas and cheese to their diet. Cleansing the rectal area, applying petroleum jelly, A&D ointment, or Desitin cream will help decrease the discomfort of the anal area and protect the skin from breakdown. Increasing fluids and adding fiber to the diet while administering stool softeners, fiber laxatives, using exercise and monitoring for beginning signs of constipation are routine measures that are taken. The amount of bone marrow suppression is related to the dose of the medication. Severe bone marrow depression is a life-threatening side effect for the patient. The patient needs to be provided education on infection prevention and what signs and symptoms to watch for and to note and call the physician when these appear. Cancer-related fatigue is distressing and persistent feeling of tiredness or exhaustion from either the cancer or its treatment. It is estimated that roughly 25% to 99% of patients with cancer experience fatigue. This form of fatigue can last long after the treatment has been completed. Non-pharmacological recommendations for the treatment of this fatigue will include increasing physical activity, minimizing bed rest and prolonged naps, maintaining a well balance between energy and activity, minimizing any emotional distress, maintaining activities of daily living, and by prioritizing one's activities. The reduction of circulation of the drug to the area may prevent the killing of cancer cells that are harbored in the blood or the lymph vessels in the scalp or the head. The main factor in pain treatment is to continue to seek a combination of interventions or various treatments until the pain is under control. Pain should be reassessed 15 to 30 minutes after a parenteral drug has been administered, and 1 hour after oral medications are provided. Medication doses should be scheduled regularly and around the clock to maintain a therapeutic drug level to prevent pain reoccurrence. The pain medication used should be known to be effective for cancer pain. Pain control or relief will greatly increase the quality of life for the patient with cancer. Acupuncture has been validated as being useful to help control the pain of cancer. By setting aside worries about addiction to opiates and believing the patient's pain reports, as well as concentrating on humane treatment, the nurse can be instrumental in helping the patient achieve a pain-free or a pain-controlled life existence. Adjunctive medications are used alongside with analgesics to help control the pain of cancer, and these may include steroids, antidepressants, as well as anti-seizure drugs. The diagnosis of cancer provides feelings of fear and anxiety for the individual during a time of great stress and uncertainty. Often patients lack knowledge about the disease and the treatment options. Routinely at the diagnosis, patients will fear death, and after treatment, the fear about reoccurrence of the disease is probable. Understanding the disease, the treatment options, and what to expect with the treatment will greatly help to decrease the fear that is experienced by cancer patients and the family. The nurse must consider psychosocial and spiritual care when working with the cancer patient, because the cancer or the disease process will affect every aspect of the patient's life in some form or fashion. Oncologic emergency, this will occur as a tumor grows extremely large. It will compromise function of adjacent structures, or when the metabolic processes or normal coagulation processes are disrupted. Tumor lysis syndrome, this is a rapid release of byproducts from cell destruction from using cancer therapies. The first sign of tumor lysis syndrome is an elevated potassium level. This can cause renal failure, cardiac dysrhythmias, or asystole. For hypercalcemia, the calcium level rises above 11 milligrams per deciliter. This is due to bone deterioration and the release of the secretion of parathyroid hormone by the tumor. DIC is caused by abnormal activation of clot formation. This will result in excessive consumption of platelets and blood coagulating factors. For neutropenia, the absolute neutrophil count is less than 500 millimeters cubed. Spinal cord depression is related to metastatic tumor and bone collapse. This will cause an impingement of the spinal cord. Superior vena cava syndrome occurs during lung cancer when the affected lymph nodes block circulation in the vena cava. When these oncologic emergencies occur, immediate action is taken to prevent severe injury or death. An increasing number of cancer patients are surviving their disease through either control or cure. Cancer, however, is still the second leading cause of death in the United States today. Elizabeth Kubler-Ross first introduced the stages of grief and dying with her book on death and dying that was published in 1969. Kubler-Ross suggested that people go through several junctures as they learn to adapt to the processes of loss or impending death. Not every individual goes through all the stages, nor do these individuals go through the stages in any set order. These 5 stages may apply to the grieving process when a body function or part is lost, a loved one dies, or one's own death is approaching. Many dying patients face varying levels of fear. These may include the unknown, abandonment and loneliness, loss of relationships, loss of future experiences, dependency and independence loss, and pain. Palliative care is also known as comfort care. There are 2 stages of dying. Pre-active, this can take weeks or months. Patients know they are dying and exhibit this knowledge routinely by withdrawing from social activities and by attempting to put their life affairs in order. Active dying usually only lasts a few days. These individuals exhibit specific signs in breathing patterns and other body functions which indicate that death is imminent. Oftentimes, the course for the patient is to choose what to take and also to be allowed to refuse any further nourishment. This is known as patient-induced intake. For end-stage symptom management, the goal is to provide comfort care for the individual. The goal of palliative care is comfort. Thereby, administering oral or sublingual medications is the preferred choice of administration. It is important for any nurse to remember that this feeling can be very frightening for both the patient and the family, and aggressive treatments to lessen discomfort is vital. The death rattle is from mucus secretions in the patient's airway, and they have a difficult time clearing their airway. Delirium can be due to medications or an altered mental status.